What's up guys, I'm Dr. Nate from Catalyst Wellness and Physical Therapy, and I'm going to show you a couple different exercises that you can try out if you're having back pain. Now, back pain itself can be, a lot of different things, so this is not exhaustive. This is just a couple exercises. If you are having long-standing pain or really severe issues, you should definitely go and see your doctor to make sure you can get properly screened. So, if you feel up to trying a few things, I'm going to show you 5 different movements. So first one is just reaching down. So feet are going to be spread apart like so. You're going to reach down towards the ground as far as you can, hang out there for a second, come back up. Try doing 5 of those. If those feel good, then you can start doing more of them. If they feel bad, then we're going to go into our second one. Our second one is going to be standing. So we're just like so, hands on the hips, kind of cradle around your hips with your hands, and we're just going to bend backwards. And you can kind of go through a large range of motion if you're able to, or you can just go through a smaller range of motion. Now, for some people, the movement that feels better is bending backwards. For others, it is bending forwards. So we just want to test that out and see which one feels better. The third thing you want to try out is going to be something that is rotational. So you can do this standing or seated. And I just have people reach across like so. So reaching across, do this a couple times. All right, and we're just trying to see if there's any particular movement that aggravates symptoms or makes it feel better. If all of them aggravate it, then that's a little bit more challenging, and you're probably not going to be able to just do one simple exercise to cure yourself. But if you do find that there is one that does feel better, that's a good sign, because you can do that a couple times throughout the day and see how you do in the following day, see if symptoms have resolved. 2 more. So there's 2 floor exercises. I do have these kettlebells out, and sometimes deadlifts are a great exercise if you can tolerate it, but that will be in a future video. This next one though is called a bird dog. So you're on all 4s. It's a really popular one. You've probably seen this around different videos if you've been watching. But first of all, the left leg comes back, right arm comes up, and then we just alternate. So we're just alternating on each side, just like so. Okay, so that's a really simple one. Sometimes that can feel comfortable, other times it is not. If you have a hard time getting onto the floor and can't get back up, I would not recommend necessarily doing this on the floor. You could try it on your bed, on an elevated surface, so you're not worried about getting back up. Last one, and this one's a little bit more intense, so try it with caution. But when you're coming through, this is called a thread the needle. So you take your hand here, you thread it through the opposite side, and you come on up. Okay, now there is a modification where you can just reach through like so and just rotate that way, and that's fine. You can test all of these out. And again, the idea is to test out different motions, see what works for you. And sometimes that can take several days or several weeks to figure out if there is a particular movement that'll work for you. Hope that was helpful. Please leave a comment below if any of these were helpful, if there was a direction that felt best for you, and if you have tried any of these before. Please like and subscribe to my channel if you want more info like this, and I will see you in the next video.